Question number 1. Which complication occurs when IV fluid leaks into surrounding tissue? Correct option is C. Infiltration. Question number 2. Which type of hand washing removes visible dirt? Correct option is D. Soap and water. Question number 3. Which type of mask is used for droplet infection? Correct option is D. Surgical mask. Question number 4. Which artery is most common for measuring pulse? Correct option is A. Radial artery. Question number 5. What is the normal respiratory rate for adult? Correct option is B. 12 to 20 times per minute. Question number 6. Which device measures oxygen saturation? Correct option is D. Pulse oximeter. Question number 7. Which of the following pulse is checked during CPR? Correct option is B. Carotid pulse. Question number 8. What is the safest side for temperature in implants? Correct option is C. Auxiliary. Question number 9. What is the best side to check pulse in implant? Correct option is B. Apical. Question number 10. Which pulse side is used for blood pressure measurement? Correct option is C. Bronchial. Question number 11. What is the best position to check a respiratory rate? Correct option is B. Sitting. Question number 12. When does a nurse check apical or radial pulse defect? Correct option is C. Arrhythmia. Question number 13. Which color change suggests poor perfusion? Correct option is A. Pale color. Question number 14. What is the best way to transfer a patient? Correct option is C. Pushing. Question number 15. What does a nurse do when a patient becomes angry? Correct option is D. Listen firmly. Question number 16. What is the Glasgow Coma scale used for? Correct option is D. Consciousness. Question number 17. Which condition causes bounding pulse? Correct option is B. Fever. Question number 18. Which bed is used for a new admission? Correct option is B. Open bed. Question number 19. How often should unconscious patient be repositioned? Correct option is D. 2 hours. Question number 20. What confirms correct nasogastric tube placement? Correct option as C. Aspirate pH. Question number 21. Which position is used for rectal exams? Correct option as B. Sam's position. Question number 22. Which side do you stand on during embolization? Correct option as C. Weak side. Question number 23. What should be documented after medication? Correct option as D. Effect and reaction. Question number 24. Which thermometer side gives the fastest temperature reading? Correct option as C. Tympanic. Question number 25. Which urinary catheter is commonly used for long-term use? Correct option is a Foley catheter. Question number 26. Which vital sign changes pulse during early hypoxia? Correct option is C. Pulse. Question number 27. Which solution is most used for wound cleaning? Correct option as D. Normal saline. Question number 28. Which position reduce pressure on the sacrum? Correct option as B. Lateral position. Question number 29. What is the best site to assess peripheral perfusion in adults? Correct option as D. Nil beds. Question number 30. What is the first sign of local IV site infection? Correct option as C. Redness. Question number 31. What is the best action when a patient refuses to a medication? Correct option as C. Explain. Question number 32. Which oxygen device is suitable for low flow oxygen therapy? Correct option as D. Nasal cannula. Question number 33. What is the minimum time required to take in apical pulse? Correct option as A. 60 seconds. Question number 34. Which step ensured privacy during physical examination? Correct option as B. Use DREF. Question number 35. What is the correct action during administration any injection? Correct option as C. Check orders. Question number 36. Which sign indicates early hypoxia in conscious patient? Correct option as D. Restlessness. Question number 37. Which bed position is preferred for promoting venous return? Correct option as B. Leg elevation. Question number 38. What should the nurse assess before giving a diuretic? Correct option as a blood pressure. Question number 39. Which finding confirms correct gastric tube placement initially? Correct option as B. X-ray. Question number 40. What is the nurse priority when a patient falls from bed? Correct option is D. SS injury. Question number 41. Which sign indicates early respiratory distress? Correct option is C. Nasal flaring. Question number 42. Which lab test must be reviewed before transfusion? Correct option is D. Cross match. Question number 43. Which body location is ideal for assessing jaundice first? Correct option is B. Sclera. Question number 44. What is the safest action when a patient starts choking on food? Correct option is a hemorrhage. Question number 45. Which sign compounds indicate hydration in adult? Correct option is C. Moist mucosa. Question number 46. Which blood pressure sound indicates diastolic pressure in adult? Correct option is D. Last sound. Question number 47. Which pulse height is best during shock for rapid assessment? Correct option is C. Humeral. Question number 48. Which angle is correct for intradermal injection? Correct option is B. 15 degree. Question number 49. Which symptom indicate oxygen toxicity? Correct option is C. Chest pain. Question number 50. Which technique prevents skin breakdown in immobile patient? Correct option is D. Repositioning. Question number 51. Which position is ideal for nasogastric tube insertion? Correct option is D. Fowler's position. Question number 52. Which phase of nursing process involves problem identification? Correct option is B. Diagnose. Question number 53. Which heart sound is best heard at the apex of the heart? Correct option is B. S2 sound. Question number 54. Which method destroy all microorganisms including spores? Correct option is C. Sterilization. Question number 55. Which equipment requires mandatory high-level disinfection? Correct option is D. Endoscope. Question number 56. Which finding indicates phlebitis at the HIV site? Correct option is B. Redness. Question number 57. Which vital sign increases first in early hypothalamic shock? Correct option is C. Pulse. Question number 58. Which thermometer site is safest for neutropenic patient? Correct option is D. Skin. Question number 59. Which sign indicates fluid overload in cardiac patient? Correct option as A. Edema. Question number 60. Which isolation requires negative pressure room? Correct option is C. Urbaran. Question number 61. Which disinfectant kill HIV on surfaces? Correct option is C. Bleach. Question number 62. Which IV cannula gauge is used for routine adult infusion? Correct option is B. 18 gauge. Question number 63. Which IV site is avoided in dialysis patient? Correct option is A. Pistola. Question number 64. Which position improves breathing and respiratory distress? Correct option is the Fowler's position. Question number 65. Which type of pain is sudden in short duration? Correct option is B. Acute. Question number 66. Which first aid step is priority in arterial bleeding? Correct option is D. Pressure. Question number 67. Which route bypass first pass metabolism? Correct option is C. Sublingual. Question number 68. Which precaution is required for MRSA patient? Correct option is C. Contact. Question number 69. Which link infection chain is broken by vaccination? Correct option is A. Host immunity. Question number 70. Which type of infection is caused by patient own flora? Correct option is B. Endogenous.